Dr David Oehme here. I'm a neurosurgeon and spine surgeon based in Melbourne, and today we're talking about disc herniation. Now, before we get into talking about the nitty-gritty of disc herniation, I want to clear up some things about the terminology used to describe disc herniation. There are a lot of terms that people throw around that are really used to describe the same thing. Slip disc, disc bulge, disc prolapse, disc herniation. They all mean the same thing. Now, in order to understand what a disc herniation is, it's very important to understand what an intervertebral disc or simply disc is. Now, if we look at your lumbar spine, the lumbar spine actually consists of 5 or 6 bones stacked up on top of each other. We can see here the vertebral bodies or blocks of bones stacked up on top of each other. Now, in order for the spine to move, we have intervertebral discs or disc in between the bone. These consist of cartilage. Now, there are 2 types of cartilage that make up a disc. A harder, firmer cartilage which forms like an outer ring, and a softer gel-like cartilage which forms the inner part of the disc that provides the disc with great flexibility. Now, when we look here, we can see the bone and the disc adjacent to each other, and then right behind the disc, these yellow things here are the nerves that go to your legs. Now, that's important for when we talk about what symptoms can get caused by a disc prolapse. Now, discs are meant to stay contained in between these spaces between the bone. A disc herniation occurs when the disc material comes out of where it's meant to be and can herniate or prolapse around where the nerves are or in other locations in the spine. So what factors predispose you to having a disc herniation? Well, the first is genetics. Sometimes we're just born with dodgy genes which predispose us to having a disc herniation. Your father might have had a disc prolapse, your grandfather might have had a disc prolapse, and you're just more prone to having a disc wearing out. Now, as we all get older, discs wear out with time. They dry out and a term that we call disc degeneration. Now, in some people this happens earlier than others, and it most commonly happens in the lower part of your back. Now, when discs wear out, this predisposes them to having a disc herniation. There's not always a clear-cut cause as to why patients will get a disc herniation. In some patients it might be a specific incident, such as having a car accident or lifting something heavy, and they have a sudden onset of pain, and we can identify that as the precipitating cause. But by far the majority of patients, there's minimal incident or a very trivial incident that may have occurred that led to the pain. They may wake up with pain. It may be as simple as rolling over in bed, or they may just sneeze and have sudden onset of pain. There's not always a specific factor or something that a patient has done wrong that has led to the disc prolapse. Disc prolapses affect people of all ages. I've seen them in patients in their teenage years, and I've seen them in patients in their 90s. So it really does not discriminate, although it is more common in people, like most degenerative conditions, as they get older. Now, the benefit for you is that disc prolapses are very treatable. Most patients do not end up needing surgery for a disc herniation, so it's important to be optimistic. Disc prolapses are a non-life-threatening condition, and with simple treatment measures, most patients will improve and get back to normal life. So it's important to remain positive in the situation that you're in. I hope you found this information useful. If you'd like more information, click on the link below to my website, or please see other videos on this channel about treatment options for disc herniation and what surgery for a disc herniation involves.